Thank you for joining us today. This is the second session in our series on the trajectory of telehealth post-COVID. We are really excited today to have Nick Desai, who is the co-founder of LA-based Heal, joining us to talk about a really exciting company in the telehealth space. In just a moment, I'll introduce Nick. Let me tell you that this series is brought to you by the Disruption Lab. We're based here in Nashville, Tennessee. We focus on corporate innovation, disruptive innovation, primarily in healthcare. Do a lot of work around new care delivery models, especially post-COVID with all the changes that have occurred, and particularly in the area of telehealth. In addition to this series, if you go to our website, you'll see a telehealth academy described. This is an 8-week cohort-based immersive kind of deep dive into telehealth, both understanding the options available as well as what other leading healthcare companies are doing in telehealth. It's really designed for companies that ramped up telehealth during the pandemic and now want to take a step back and think about, okay, how do we want to move forward in telehealth? So if you're interested in that, please reach out to us. We'd love to talk to you about participating in that. For this series, we have a great lineup, including both innovative healthcare companies like Heal, as well as leading healthcare provider organizations like last week with Mayo Clinic, just a really interesting discussion. And this coming week, this next Friday, we'll have Envision Healthcare. Julie Stover, who's Vice President of Virtual Care Strategies for Envision, will be with us. Envision is based here in Nashville. They have a reach across the whole country. It's going to be really interesting to hear their approach and how they're thinking about telehealth moving forward. But today we have with us Nick Desai, and I'm going to go into quite a bit of depth introducing Nick because the company is so interesting, and Nick is a very interesting leader of the company. I was just telling him that we've been doing disruptive innovation for several years now, and one of our original decks around this included his company, Heal, and it's so exciting to have him as a part of this session. He's a visionary serial technology entrepreneur who has successfully founded, built, and led 4 investor-funded startups across social media, mobile wellness, and healthcare over the last 20 years, and that is not easy to do. Nick is is founder and until just recently CEO of Heal, which is the category-defining leader in home-centric primary care. Since founding Heal in 2014 with his wife, Dr. Renee Dua, Nick has led the company's growth with Heal Doctor House Calls and telehealth now available to 145 million Americans in 11 states. Having delivered over 250,000 house calls, Heal has earned a plus 82 net promoter score, which is really good, and realized over 88 million in healthcare cost savings to consumers, insurance carriers, and enterprise customers. Heal has been recognized as number 13 on the 2020 CNBC Disruptor 50 list, the 2019 Consumer Electronics Show Small Business of the Year, and number 114 on the Deloitte Fast 500, among many other awards. Nick has raised over $200 million for Heal and investment capital. Again, that is not easy to do either. Including from the likes of Humana and Fidelity, individual investors like Paul Jacobs, the former CEO and chairman of Qualcomm, and even entertainer Lionel Richie. So Nick has been busy raising money. Most importantly, Nick, by the way, is an engineer. He's led Heal's product development to innovate industry-leading capabilities, including the first ever upfront price transparency in healthcare, on-demand same-day doctor house calls, real-time remote monitoring, and one-touch telehealth. Nick often says that users shouldn't learn technology, technology should learn users. And that's an important lesson for us in healthcare and one that we really need to apply. He lives in Pacific Palisades with his wife and three young children and is a first-generation immigrant, having been born in Mumbai, India. So Nick, it's really an honor to have you with us. We're excited about this session. To our participants, if you have questions, enter them in the chat and we'll have some time at the end for Q&A. With that, Nick, I'm going to hand it to you.
Well, thank you so much. It's weird to hear my own bio and think, wow, on one hand, wow, I've done all those things. And on the other hand, still feeling maybe it's the immigrant parent thing, but wow, I haven't done anything yet. I got a lot more to do. But it's great to be here. It's great to talk to the audience and to be invited. Thank you for the opportunity. I think I'll jump right in and get to the heart of at hand, right? Which is, what is the future of telehealth, but broadly, what is the future of care, primary care in a post-pandemic world, right? And the first part of that I want to say is how incredible, how I can't even believe that we're even talking about post-pandemic as a real thing that we may soon achieve, right? Here in California, they're saying in about 2 months they would fully open up the state. We're already, 20 million Californians are vaccinated. We're sitting outdoors at restaurants very often. My kids go back to in-person school next week for the first time in 13 months, right? So it's nice to know that. And unfortunately, I think we have to acknowledge it came, whatever the reasons and whatever your politics, it came at an incredible human cost, right? By the time this pandemic, and we have achieved the kind of vaccination rates that we need to achieve herd immunity, 600,000 Americans will have perished from COVID, and millions more will suffer from long-term health consequences, right? We're going to be talking about COVID onset diabetes and COVID onset brain disease and all of these different things that we don't even understand yet. So, to be able to think about a world in which there is some semblance of normalcy, though, sort of always, if you remember the first few years after 9/11, everyone was more vigilant about things and whatever. And hopefully we will keep that vigilance as it relates to pathogens and future pandemics. I think that when we talk, I read two interesting data points this morning as I was thinking about this talk, right? That in the year since the pandemic started, the percentage of Americans who think that they can get a good healthcare experience over telehealth has gone up from about half of Americans surveyed to about 80% of Americans surveyed. Okay, wow, that's a big increase, right? And COVID was the catalyst for that, because people didn't want to go to the doctor's office. They tried telehealth, they had a good experience, et cetera, right? At the same time, the Health Information Management Society, HIMSS, put out a data point a couple of weeks ago that of all the people who used telehealth in 2020, during the pandemic, 85% had a household income over $150,000 a year, right? Which means most of the people on this call and people like us know how to use telehealth and maybe how to get value from it. But the people who need healthcare most, right? The people who, the most needy, most costly patients in our society are also most neglected, right? And there's a fundamental reality that we cannot, there's been a lot of talk, right? The pandemic came along at the same time that the discussion about equality for women, equality for ethnic minorities, equality for transgender, equality for African Americans, these things came to a boiling point of discussion and action in our society in a way that perhaps hasn't happened until in the 60s. But, and the one of the fundamental paradigms of that is that you can't achieve equality in life without there being equality in healthcare. Okay, because if you are fundamentally doomed to live a shorter lifespan, 3 to 5 years, based upon nothing more than the zip code you were born in, where you had no control over the zip code you were born in, which is often determined by your parents' socioeconomic status, right? You are inherently unequal, right? I think in the life, liberty, and pursuit of happiness, life comes first. And so being able to live a quality, healthy life comes first. And how are all these points related to the future of telehealth post-COVID? How should employers be thinking about this? How should insurance be thinking about this? Is what we have now is a society between what we did at Heal, which is Dr. House calls, right? We did telehealth for us came much later in the game in 2019 and then really grew in 2020. But from 2015 onwards, we were delivering Dr. House calls in person, the doctor actually coming to your house, right? And I'll come back to that in a minute. But whether it's a Dr. House call or whether it's a telehealth interaction, right? And telehealth, think about it broadly, right? It's not just, up until very recently, just in the last 3 or 4 months, have people started thinking about telehealth as more than triage, right? If you think about telehealth this time last year, it was, oh, it's after hours. I can't get a hold of my doctor. I'm going to go on to Teladoc or whatever service my insurance company pays for, and I'm going to tell them, and they're going to tell me one of three things: go to the emergency room. You don't need to worry about this. Schedule time with your doctor. It can wait a couple of days, or here's a prescription for a 3-day supply of whatever medication can help in the very near term with this disease. Right now, people are saying, well, can telehealth be a primary point of interaction? Can telehealth effectively deliver mental health services? Can telehealth reach the rural and the socioeconomically disadvantaged? Can telehealth integrate specialty care? Right? These are all conversations that are happening now. But going back to what happened over the last year, what we saw is a very interesting development, which is consumers in America are starting to dissociate in a good way quality health care from a building, right? And if you think about American healthcare, that has been one of the core issues all of this time, right? Which is that whenever we talk about great healthcare in America, for those of us who have the privilege of even talking about great healthcare, right? It's a place we're talking about. U.S. News and World Report puts out the best hospitals list, and I live here in California, and UCLA is number 3 or 4 or 5 or whatever it is in the country, and Mayo Clinic is this, and Brigham and Women's and Sloan Kettering, and these are buildings, right? But there's nothing magic about the 4 walls of a doctor's office, right? It's what the magic happens when a caring, quality, qualified healthcare professional has the time, the data, the care, and the compassion, the tools, all to actually deal with you and to understand your healthcare needs and to deliver high quality healthcare to you, right? What's important about that is all of those things are important, right? A doctor who sees you on telehealth in their office or in your home that is harried and overwhelmed by billing and spending 65% of their time on bureaucracy, which is where doctors spend their time right now for the most part, and doesn't have your prior health records. I don't care where they went to medical school and residency and fellowship and how many boards they have, they can't be that much help, right? And so one of the things that came out of Heal that we know is whenever you talk about bringing a service to a patient's home that used to be done in a place, right? When you talk about, I'll take a classic example of Grubhub, right? The food, or Seamless, the food delivery services we all use every day now. It's great. And during the pandemic, it kept restaurants going, and it kept me and my wife from having to cook every single day and get sick of eating the same 3 things. And but it's not quite the same as sitting at a restaurant, right? There's still the kids screaming in the background. You still, sometimes the food comes a little cold. You still have to take it out of the cardboard box and heat it up. It's not the same experience. It's pretty good, but it's a little bit less good than, hey, I can go to a restaurant, right? And sit there and table service and hot, fresh food. And if I want extra Parmesan cheese, they have it and all of those things. Um, what what we learned at Heal is that when you deliver a doctor house call in the patient's home, you can actually deliver a better experience, a better clinical experience, not just one that is more convenient. And convenience is for us and the people on this call. I think convenience is an important factor for the people who are the 1/3 of seniors and 1/4 of all Americans who have socioeconomic, transportation, demographic, or health issues that prevent them from easily getting to a doctor's office. Seeing a doctor at home can be the difference between seeing a doctor at all or not, right? It's not about convenience, it's about necessity. It's the difference between getting care and not getting care, right? So, but what we saw is that regardless of why you let the doctor in your house in the first place, the doctor can deliver better care because of two important reasons. The first is the patient feels that everyone is a king in their own castle, right? We're all most comfortable at home, right? There's no white coat effect. The doctor's sitting on my couch. I'm not worried about the parking meter. I'm not worried about what do I have to get from the grocery store. What errands do I have to run? I'm not intimidated by the other sick people there, wondering if they're vaccinated or not, right? I am in my own house. But the more important reason is it's the only place the doctor can see the social determinants of health, right? Your fall risk, your allergens, your what's in your refrigerator, what's in your pill box, what medications are you prescribed and taking, what medications are you prescribed but not getting a chance to take because they cause you nausea. Do you have food insecurities? Are you able to get in and out of your bathtub, right? Do you live with other people? Is there smoking in the house? These factors, according to a Harvard Business School study, determine up to 80% of our health outcomes. And how is this relevant to the future of care when 80% of people also think that care can be delivered virtually, right? Which is if it can be done with the equal quality as a doctor house call, with the equal clinical efficacy as a doctor house call, is even more promising because it enables the doctor to see more people. It enables the patient to be sitting in their pajamas or bathrobe, right? Not having to worry about who's in their house. It enables all of those things. So what we have to do now with telehealth is the first thing is we have to stop thinking about telehealth as care, but rather as a tool in terms of how I get care. The same way that a building doesn't deliver care, a Zoom call doesn't deliver care. A Zoom call only delivers care if the person on the other end of the call is qualified, has the time, has my data, has the tools, has the diagnostic capability remotely to understand all the things they need to understand, and maybe some more, because facial recognition and optical technologies are enabling people to understand your blood pressure and all these kinds of cool things are being developed, right? But the goal of telehealth has to be that it becomes a primary form of relationship with your doctor, right? Not a transactional relationship with a random provider who is telling you, who's doing triage, but not really healthcare delivery. It has to have data. It has to be driven by data. It has to be able to assess those social determinants, and it has to cross the digital divide to be available to the people who are most likely to benefit from seeing a doctor this way because they don't have a car, they can't get to the doctor, they live 100 miles away from a doctor's office, they don't speak the language, whatever the other factors are, that they can get care because the internet can be a more universal tool. And if that means we have to put a tablet in our house, so be it, right? If that means we have to give patients a kit that allows them to measure their blood pressure and their blood sugar while they're on the phone, if that means we have to develop more advanced technologies than the camera of this phone that can look at me and assess my, do I have a fever? Do I have high blood pressure? What's my pulse ox, right? You know, it means that these kinds of innovations are still necessary. So I would say that the future of telehealth post-COVID requires substantial additional innovation in three core areas. The first is the diagnostic capabilities that the doctor has, okay, or the clinician, the nurse practitioner, the mental health therapist, whatever else it is. There needs to be substantially greater diagnostic capabilities, right? The second thing that there needs to be is data, prior health records, right? Just this week, Monday, was a 21st Century Cures Act that requires that all your care plan and your health records have to be made easily and digitally available. A long time coming, extremely necessary regulatory push to unlock and break down the walled gardens of the epics of the world, right? So that your records belong to you, but so that they can securely be delivered to the person taking care of you in timely, actionable data at the point of care is critical, right? That innovation, the fact that the law now requires it doesn't mean that the average telehealth doctor has it, right? The third area of innovation, actually there's four, is making sure that you are able to connect to your doctor and have a continuous longitudinal relationship. Because what is true, regardless of the forum in which you see your doctor, are they coming to your house? Are they on telehealth? Are you going to their office? Or some combination of those things? The continuity, the longitudinal relationship of that care delivery is critical to the success of a increasingly personalized, increasingly effective care delivery plan, right? And that drives adherence and it drives engagement and it drives, because when the same person talks to you 2 weeks later, well, I started you on metoprolol for your blood pressure. Okay, are you taking it? Well, no, doctor, it caused me dizziness. I don't know. I feel nauseated when I take it. Okay, well, let's switch that one out and try benazepril, right? That contextual conversation, picking up where you left off, building a warm personal relationship has to be a core goal of telehealth. And then the fourth thing I think is thinking beyond triage, which is this is primary care, it's specialty care, it's proactive care, it's preventive care, it's mental health. We know, I was reading some data on this, that between 40 and 60% of diabetes and chronic kidney patients in America suffer from some form of anxiety or depression or mental health issue. And addressing those issues are critical to arresting the march from diabetes to chronic kidney disease to ESRD, where the costs explode, where you're on dialysis, right? So I think that we have to look at this as a watershed moment that people are willing to engage in this forum, right? But if we look at any other analogy on the internet, right, Amazon went from selling me books to selling me everything, right? And Netflix went from sending a DVD to my house to as soon as I hit the button versus my kid hits the button on our Netflix account, which are tied to the same billing, it recommends the shows and movies I'm likely to watch to me. And these shows and movies my 5-year-old is likely to watch to him, right? And that kind of personalization, that kind of customization, that kind of progression has to take this experience to the next level. And in that process, we have to see disruption necessarily in the business model of telehealth, right? Because the first contracts around telehealth that payers did, were a PMPM structure in which breakage worked in the favor of the telehealth provider. Big telehealth company comes in, says, pay us 50 cents or 20 cents or $1 or whatever it is per user per member per month. That's what's called a PMPM, but it's on 5 million members. Okay, so now they're getting $5 million a month, but 1% or 2% or 3% of those people, or 4 or 5, whatever it is, a small percentage use telehealth, and the breakage works in the favor of the telehealth provider, right? That's okay when telehealth was a novelty and it was designed to cut use to the ER and it was designed to do some of those things. But if we're going to look at it as a primary interface, right? There has to be an invention of a business model that actually works for both the patient, the payer, and the provider. And the payer in this case might be a large self-insured corporation, right? Google or Hulu or Activision Blizzard or Hyundai are as much payers, all self-insured companies, as Humana or Aetna or WellCare or Blue Shield are as much payers as the government of the United States or the government of any state, because ultimately that's where Medicare and Medicaid, Medi-Cal, and these kinds of programs end up, right? The payer community or a value-based plan, right? If you're taking the risk for your patients, it has to financially work for all three of those constituents. And one of the euphoric things that has happened in the growth of telehealth over the last year is that the government stepped in, rightly so, and swiftly, and said, and insurance companies stepped in and said, we're going to reimburse full primary care rates for every telehealth interaction, because they wanted them to happen, because people needed to get their doctors. That's probably not sustainable economically, right, for the payers, unless the telehealth becomes as effective as the office-based or home-based primary care experience, right? So the invention of the model that telehealth is a part of how I take care of a patient, right? And I'll give you this example, and it will hit home, I think, for most people, certainly those that have a loved one or children in their life, right? FaceTime is not my relationship with my kids. FaceTime is a part of how I communicate with my kids. It's one small part of how I show my kids love when I am not sitting next to them, but it is not my relationship with my kids, right? Similarly, telehealth has to be that integrated tool that is so seamless, so useful, and so usable. And that's why I think that the entry of somebody like Amazon doing telehealth is such a good thing, because it has gone to a commodity service. Everyone has it. It's no longer the tool that's the novelty, it's the experience that has to stand out, right? Where will you go for your telehealth? You will go to the doctor you like, just as where you went to the doctor's office. Every doctor had an office. You didn't pick the doctor based on how nice their office looked, right? There are a couple of companies out there right now trying to build businesses based on how nice their office looks. I just think that's folly, right? It's about the relate. Was it technologically easy for me? Did the provider spend enough time with me? Did they get my data? Did they ask the right questions? Did they follow up with the medications that they said they would, or the prescriptions that they said they would? When I got to the pharmacy, was the prescriptions there, or could I get them delivered? Right. So I think that Amazon's entry into the space shows the ultimate tip to commoditization of this technology that now needs to become an integrated part of the healthcare experience. It needs to be an integrated part of a primary care doctor's experience. It needs to extend to all of the related service providers, mental health specialists, home health workers, physical therapists, occupational therapists. All of these different people should be able to use this tool, maybe simultaneously, maybe asynchronously. It needs to be data driven. There needs to be more important diagnostic capabilities. And there needs to be more accurate diagnostic capabilities. And there needs to be data-driven care. There needs to be a better business models around the integration of telehealth into the experience of every provider with every patient as a tool in the care delivery model, right? Now, the last thing I'll say is that if you are a large corporation and you are thinking about this, right, telehealth is one more opportunity. An insurance company, people don't love when I say this, but large self-insured companies have long worked with giant insurance companies as their TPA, right? They pay a certain amount of fee to get the member cards in the network in this, and more companies are looking at decoupling that fee because they want to provide a more curated solution to their employees. That because every company, are they younger, are they older, are they this, are they that, are they tech savvy, are they not tech savvy, et cetera, right? It's easy to imagine that the needs of the average Google employee may be different than the needs of the average employee of a, you know, car manufacturing plant in the middle of Ohio, right? Um, So they want to be able to curate those solutions. They also want to really be able to save money because they are payers. They want to be able to integrate wellness solutions. So telehealth gives you the ability to further disentangle from the payer because it has, now that there's prescription delivery, now that there's ubiquity of telehealth, if you give people access to care, right? And if you give people prescription delivery in a well-designed, intuitive interface, which a lot of companies are working on and making, right? Just this week, a company called Firefly Health closed $40 million, right? For sort of being the Kaiser for small businesses, where they integrate all your care in a video experience. Good for them, right? But if you can do these things, it becomes more of an opportunity to innovate and curate the right kinds of services for you, right? But and the very last thing I'll say, I think I said the last one was the last thing, but sorry, there's one more last thing, is we cannot lose sight of the fact that, when we talk about who is the payer in healthcare, we say, oh, it's my insurance company, it's my employer, it's Medicare, it's Medi-Cal, it's whatever. You know who it really is? In every single one of those cases, it's all of us. We're all the payers. Every single American is a payer in healthcare because ultimately the employer is taking it out of your paycheck, the state's taking it out of your taxes, the insurance company is charging you a premium, right? Medicare is taking it out of the Medicare fund that comes out of your paycheck, right? You're the payer. We're all the payer here, right? And health equality and making sure that the neediest patients, the most socioeconomically disadvantaged patients, the least tech savvy patients get access, that we break the barriers to give them usable, useful, high quality access to care, is not just a moral imperative, it's an economic imperative, because healthy people cost less. And if we help those people get the care they need so they don't run to the ER, they don't move the progression. A person with diabetes costs between $5,000 and $10,000 a year to take care of in the healthcare system. A person with on dialysis costs $85,000 a year to take care of. Right? There are 84 million Americans who are pre-diabetic, 35 million who are diabetic, 40 million who have chronic kidney disease, and 1 million on dialysis. If everyone keeps moving down that train, that's an exploding $2.5 trillion time bomb that we have no idea how to pay for. So as we think about these solutions, we also have to think about how we innovate for the people who are least likely to be early adopters and most likely to need their hand held to come onto platforms and services that they can genuinely use, because it's in all of our interest that they do. So with that, I hope that was remotely interesting and enjoyable. I will pause and take a sip of my tea and let people ask questions.
Nick, thanks. That was absolutely amazing. Let me remind everyone to put your questions in the chat. We'll get to as many of them as we can. I want to start with two questions. The first question, and to the extent that you can disclose, what's the next step for HEAL? Where strategically, where is HEAL going? And secondly, now that you're out of the day-to-day, I assume you're out of the day-to-day, what's next for Nick?
Well, I will answer the first question briefly and say, out of respect for Scott Vertrees, the new CEO we put in at HEAL, what's next for HEAL is a question for him, right? What I do know is that HEAL will always be committed to being an innovative company that delivers home-based primary care using Dr. House calls telehealth and remote monitoring to patients of all ages, particularly in the Medicare Advantage segment, to help them get the care they need, lower healthcare costs, and improve their outcomes for the patient, to reinvent care delivery for the doctor. When we founded HEAL, Renee, my wife, who's my co-founder in HEAL, had said something that is very, very important, which is you can't fix medicine for patients without fixing it for doctors first. We will hopefully continue to do that at HEAL and continue to grow and build a business that grows on the basis of delivering exceptionally high quality patient care to patients, right? What's next for me is when I left Heal, I thought it was I'm going to sit at the beach for a few months, and um, then I went to Mammoth a couple of times with my kids, and I did sit at the beach for a day and a half, and then I was like, all right, well, I got to do something, right? And there's just that, and then I have a my wife who is the hardest working person I've ever met. It's like, get your lazy ass in gear and go do something. So I'm thinking right now, I've honestly been flattered and humbled in some ways by the number of opportunities I've been approached with. I'm also, a serial entrepreneur, so maybe I'll cook up something. I don't know yet exactly what's next, but I know it will be broadly in the space of health and health technology. When I left Heal, I was interviewed, and I said something that I still am very obsessed by this problem, which is, why is there no app or service or digital solution in healthcare that 10 million people use or 100 million people use, right? When we think about Netflix, we think half of them or a third of American households have Netflix. We think about Uber, we think 4 people has used Uber in America. We think about the best used healthcare apps or services, it's like 0.2%, right? Why is it not those larger numbers? And why are we not crossing that equality threshold? So I'm thinking about those areas, but I don't know exactly what's next yet.
Okay, that's really helpful and interesting, and I am not surprised at all that 2 days at the beach was enough to spur you to the next entrepreneurial venture. So if you think about uh, healthcare providers, the typical provider organization that has ramped up their telehealth experience, but now want to do that step back and say, okay, where do we go from here? To some extent, we just kind of used uh, methods to kind of tape together our existing experience, what we had before, and we weren't really in a position to strategically think about it in the middle of the pandemic. What advice would you give them in terms of next steps, or at least first steps in moving forward?
Yeah, so look, in that sense, the pandemic was a tactical accelerator, not a strategic accelerator. It was just throw
Right.
the stuff, make it available, save people's lives, right? Give them care. Great. And I have to say that during that year, in the last year from February of 2020 to February 2021, right, when we were building Heal and raising around and launching telehealth and working with insurance companies and working with the government, everyone really did come together in a very, very pro-patient way that it was refreshing to see in healthcare. It was just like, yeah, we'll pay whatever, just get it done, right? Now, the strategic step has to be, do you view digital care delivery as a secondary or a primary access point to care? Do you want to train your member population, your patient population, your employee population, depending on who you are, to think, go to a doctor's office or first, get a house call first, or use telehealth first, right? If you want to do the third of those options, you have to think about digital first care delivery, digital first primary care, and reinvent the entire provider network that you're a part of. Reinvent who you're selecting, right? Because what a lot of care in America, particularly here in California where I live, is owned by large groups, IPAs as they're called, right? They're not really, they're giant groups or huge organizations that are hospital centric, as in location centric, Cedars, UCLA, um, or they're vertically integrated. So Heritage, Sutter, Dignity, these kinds of places, right? And the, those are fine, but you may have to, they may say to you, the payer, hey, well, we're going to do the care. You pay us some money. We're going to do the care delivery the way we want, right? Maybe they want to innovate too, but you may need to think and look at it and say, I need to find a whole different set of provider network architecture so that my entire experience is digital first, digital second, only only acute care, surgeries, trauma, these kinds of things are delivering a baby, these kinds of things are leaving the digital world. Labs, they're I can think of more things, but the point is only few things are leaving the digital realm. And I think it requires a fundamental structural redesign.
Yeah, great point. Thank you. You talked about mental health some, and I think a significant part during the pandemic of the growth of telehealth was in the mental health area. Uh, do you see, or how do you see telehealth finally integrating mental health into the continuum of care in a much more integrated way?
Well, here's what I'll say. Mental health is primary care, period. End of discussion, right? Those are not separate things. And it took us a long time to figure that out in America, but I think we're there now, right? Mental, whether it's a diabetic patient uh, or a cancer patient, or just someone who is incredibly from sitting at home for a year, right? Yeah, some of us had jobs and some of us had places we could go to work, and a lot of people had economic hardship. Whatever the reason is, mental health is primary care. And what has to happen is that the doctor, as in the clinical interface from a typical medical, what we think of a PCP or internal medicine, pediatrician, family medicine doctor, that person and the mental health professional, whether they're psychiatrist, psychologist, MFT, social worker, wherever up and down that food chain they are, they have to work in close concert, right, around the data. In my opinion, virtually, I mean, other than perfectly happy, healthy, children and young adults and whatever, anyone going through any health issue should interact with a mental health person for some period of time. And doing that is not adding costs, it's actually moving that care sooner to positively impact adherence, to positively impact. I mean, study after study after study has shown that people with XYZ disease, they don't take their medications because they've sort of lost interest. They've given up on themselves, right? And it's all of us are prone to that, right? We all, there's that quarantine weight gain thing everyone's talking about, right? I didn't need the quarantine to gain weight. I just like food myself, but there's a quarantine weight gain thing people are talking about. There's an increase in alcoholism people are talking about. There's an increase in substance abuse. Sadly, there's an increase in domestic abuse that people are talking about. All of these things need to be arrested and addressed early. And I don't mean arrested in the legal sense. I mean addressed as early as possible so that people are getting the treatment they need, because often effective mental health treatment can help avoid some of the clinical interventions we end up having to do for these patients. So that my view is that now there is an opportunity, there is a imperative, and there is an understanding, and there are the tools that these things can sit together, right? Your doctor should see your therapist notes, your therapist should see your doctor's notes, everyone should know what medications you're on, your mental health professional needs to know your blood pressure and heart rate and pulse ox as much as your doctor needs to know, are you feeling depressed or lonely or detached or anxiety or whatever the case may be, right? So I think that telehealth has an incredible opportunity to make those things work like this, as opposed to disparate, disconnected things.
Thanks. Steve, why don't you unmute? You have a question about the gold standard. Ask your question.
Yeah. Nick, who do you consider the gold standard as far as a group who has effectively integrated telehealth into their full care delivery model?
I mean, this is going to be a biased answer, but I would say HEAL, right? And I honestly believe that. Okay, yes, I was CEO and I founded the company, but you built a relationship with a doctor who came to your house or talked to you by video first, and that same doctor delivered your care, right? And that doctor was enabled by remote monitoring data services. And we have, at least in California, mental health professionals on the platform. So your doctor can recommend you to a mental health professional. that mental health professional can talk to you on the same platform. They can all see your data. Exactly what I just said, we actually did, admittedly at a small scale. Now, are there others who are doing that, others who are thinking about that? I'm sure, right? I didn't, I don't know. There's not a name that comes to mind off the top of my head, but I'm sure I'm not the only smart person alive, right? So I'm sure a lot of people are thinking that way.
You can send Steve a check for that
Yeah,
question.
yeah, thank you for the Sheila.
I think we have at least one more question, but we're at our 11:45 time. If the person asking the question or anyone else of the participants would like to reach out to you, what's the best way to reach you, Nick?
I'm Nick at the number 6, the letter D, VC, right? Nick at 6dvc.com.
Great.
Reach me there.
Thank you so much. Just really helpful to understand your perspective, the energy you bring to it, the vision where we're headed with telehealth. It is so exciting. We want to keep up with what you're doing and hear about once you decide where you're going with your next venture. We certainly want to stay in touch and learn what you're doing next step. But thank you so much for taking the time today and spending with us. Just a great session.
Thank you. I really enjoyed it. Thanks to all the people who asked questions. And there's one in the chat from Courtney. I'm going to make sure I answer that over LinkedIn. I see you connected with me there. So I'm going to make sure I answer that for you. And to everyone, thank you. And let's keep innovating and let's stay safe and, let's increase the peace.
Thank you so much, Nick. And to everyone, thanks for participating. We'll see you next week.